Hello, and welcome to the Homepage Network. I'm Sarah Vogt. Safe, effective COVID-19 vaccines are a major development in our battle against coronavirus. Curious about how these new vaccines work? Join us as Dr. Rodriguez of the Laurel Health Centers walks us through the facts on COVID-19 vaccine safety, efficacy, who should be vaccinated, and why getting the vaccine is so important to getting our communities back to normal. On our last broadcast, Dr. Rodriguez, we teased the audience with this question: can I get COVID-19 from the shot?
The answer is absolutely not. Okay, very simple. What you're getting is a protein compound that helps your immune system boost up. It is not a live inactivated vaccine. Those are the ones you have to be concerned about, that you could get some reactions. But otherwise, at this particular time, with the COVID, with the tetanus, with many of these vaccines, the flu vaccine, you cannot get these illnesses from these vaccines.
Mm-hmm. Well, is there some way we can prepare ourselves to get this vaccine? What preparation measures would we take?
The most important one is knowledge. You want to know why you're getting the vaccine. If you have, listen, every time I get a shot, I get sore, take a little Tylenol beforehand, so that way we'll prepare against the shot. Like I said, there's the V-Safe tracker if you want to know possible side effects, and communicate with your healthcare professional. I said, listen, I received the vaccine. I'm having these side effects. Could this be part of what I need to be concerned about? The good news, most of the providers administering the vaccine are ahead of the game. They're giving you handouts. They're giving you information with that. But I cannot overemphasize enough, after you get your vaccine, hold on to that card. That card, I guarantee that in the next 6 months, many people are going to say, oh, listen, have you been vaccinated? What proof you have your vaccination for travel, for activities? If we're going to reopen the country, we want to make sure that everybody's safe.
Yes. Well, a lot of questions. We have a lot of questions about all of this, but another question I think I hear a lot is, what can I expect when I receive my vaccine?
You're going to find some soreness on the area. That soreness, depending on the vaccine, might last 24 to 48 hours. Some people feel a little bit of weakness. Some people, they say that I feel like the general malaise. But I must say that from the group I have seen vaccinated locally and nationally, that just mostly soreness and general feelings of fatigue within 24 or 48 hours of the vaccine. And after that, that goes away. If you develop an allergic reaction, that's something different. Or I develop swelling, itching, I got a redness of the area. Well, that's something completely different. And remember, most of the times it's not the vaccine, it is the components of the vaccine that give you the allergic reaction. Oh, we decided to mix this with certain minerals or things to make the vaccine, be effective, and you react against those components.
Mm-hmm. For those of us considering the vaccination, when can we be vaccinated and how do we sign up?
At this particular time, most centers are right now running lists. We have right now, I just came up from a meeting where this office in itself has a waiting list of 720 patients for the vaccine. So what we do is we go through the medical problems of the patients, and then we create a stratification that says, okay, these patients should be receiving their vaccine first, and then these ones will follow up. And then we're waiting for the vaccine to come. And you're going to find out, for example, last week we got 250 vaccines. This week we only have 100. So we're waiting on that. So my advice is always sign up as soon as possible for the waiting list. If your number comes up and you say, I am not ready, can you bump me down the list? That's fine. But at least you have a spot. I don't want to make anybody missing on this just because, I've been calling all over and I cannot get on the list. Right now, for example, I checked last week, I don't know this week, Geisinger shut down their list. They don't have no more space. You see? So we want to make sure that all our patients get on the list. Now, where on the list you're going to be will be depending on your risk factors. But my advice, get on the list as soon as possible. And as soon as those vaccines come in, we're going to start giving them to everybody.
Now, before this vaccination happens for those concerned, how do you feel about masking until we all conquer this thing? And what were you saying about when do you have a date for that to happen?
Well, right now, I was mentioning to everybody, right now from the White House came the 100-day mask mandate that they want to do this, that they would like us to mask for the next, for the next 100 days. That was a couple of weeks ago. So my personal goal, I give to my patients is, listen, give us 90 days. So think of tax day. Think on April 15, wear your mask till April 15, and God willing, if everybody in the United States does this, okay, we'll get out of this. I am so positive of that because remember, mask is not for you. Mask is for your fellow man. You want to help your fellow person next to you not get sick. Oh, I got my vaccine already. I don't have to worry. I mean, I have my protection, but I wear my mask because I have to think about my fellow patients, my fellow colleagues, my fellow staff, my fellows outside. We want to help everybody. We're not this together. This is not me against you. This is all of us together. We can do this. Oh, and listen, if you says, I don't believe on the mask, I don't think they're right, then don't do it for yourself. Do it for your mom. Do it for your friends. Do it for your family. Do it for a stranger that you don't know if next to you that stranger is immunosuppressed, and we don't want to get sick.
Yes. Well, Dr. Rodriguez, for those listening to this broadcast today and viewing this broadcast, they can sense your passion and care for all of us during this time. So thank you for answering these questions to give us more knowledge and insight about the vaccines and about COVID-19.
You're very welcome. Thanks for having me.
Laurel Health has been working hard behind the scenes to ensure vaccines are distributed as quickly and efficiently as possible. If you would like to join Laurel Health's COVID-19 vaccine waitlist to be notified when appointments are available for your group, call your Laurel Health Center at 1-833-LAUREL-HC or visit laurelhc.org for a full list of locations near you. Thank you for joining us today on the Homepage Network.
The Mansfield Laurel Health Center is now accepting patients in the state-of-the-art Susquehanna Health Medical Plaza at Mansfield. In the same facility, Susquehanna Health is offering physical and aquatic therapy, imaging, laboratory, cardiology, and sports medicine services. For more than 40 years, our 6 Laurel Health Centers have provided high-quality, compassionate care to the residents of Tioga County, offering family-based primary care services, obstetrics, pediatrics, preventive screenings, and diabetes education, as well as outpatient counseling and therapy services. Our passion is to provide comprehensive health care to all who need it with dignity and respect.